began in Wuhan, China in 2019, spread like wildfire across the globe. We all thought by now the storm would be over, but otherwise. Well, it appears there's light at the end of the tunnel with the COVID-19 vaccines, but it's not yet uhuru. Where are we in the fight against the pandemic? This is what we'll be looking at this morning, and joining us to discuss that is pharmacist Olukemi Agbojo, the Assistant Director, Pharmaceutical Services of Ogun State Hospital Management Board. Well, you're welcome to the program.
Good morning, viewers.
Good morning once again, sir. So looking at the COVID-19 issue and looking at vaccines right now, the National Primary Healthcare Development Agency have said that, oh, we are ready to receive vaccines. From your own perspective right now, do you think Nigeria is ready to receive those COVID-19 vaccines?
We are ready because normally, apart from COVID-19, we have been receiving vaccines and we have been using it. And it's just an aspect of it. Just we can say arithmetic is an aspect of mathematics. So it's not new.
When we say we are ready, the question in the mind of most people is that, okay, this Pfizer and BioNTech vaccines needs to be at a level when the temperature needs to be at about minus 50 degrees Celsius. Our storage facilities, are they on that capacity? Are they sustainable to be at minus 50, minus 60 degrees Celsius? Because yes, we have heard government saying that, okay, we have always had the polio vaccines, but is the storage maintenance the same thing with the COVID-19 vaccines?
Storage maintenance, the way we stored polio vaccines, anti-rabies, and some other thermolabile products. It's the same thing. It's the same story. The only thing is that the temperature may differ. Each product has temperature range. Okay? And that is a question of technology. It's a question of technology. You know, we have some household freezers or fridges. Okay? You can remote control the temperature. If you want it at 0 degrees centigrade, if you want it at minus 20, well, it's the same thing. Everything will be stored according to the temperature of the manufacturer.
So right now we are sure that, okay, our freezers are ready, our cold rooms are ready.
We are sure. It's not new. It's not new. It's not new. It's not new.
According to WHO, they're saying Africa in danger may be left behind because they are looking at our facilities. You know, can we preserve? Can we store these vaccines? And looking at that now, WHO has warned that Africa is in danger of being left behind in assessing safe and effective COVID-19 vaccines. But you are saying otherwise.
What I'm saying is that, you see, let me make a little diversion. Initially, when COVID-19 was at the epidemic over there, we never experienced this. The affair is that when this thing comes to Africa, all of us, we kill all of us in one day. Okay? But they find out that, by then, you see, different areas has different peculiarities. Okay? I don't believe in those things. I believe in practicals. So when you say things cannot work in a place, have you tried it? It has not been tried. Okay? Let's try it and see. If it's going to work, we see. If it's going to work, but I'm telling you that the storage condition, like you say, when you saw other vaccines, South Africans have been used to vaccines. So we are used to vaccines. We use vaccines all the time now. Okay. The same thing. What we really need is to do is that the manufacturer will give us specifications. This thing will be stored at so temperature. As I said, it has a range between this temperature and this temperature. The freezers and some other things, some deep freezers that are being used in this country, they have a range. The detail of what we have at home. Okay, as I said earlier on, that you can twist it within the temperature that you want.
Okay. Looking at it now, the National Strategic Cold Room storage in Abuja saying that, okay, yes, they are ready, as you have said, but then we do have other storage centers across the 6 geopolitical zones in Nigeria. When we look at logistics, moving it from Abuja to these places, do we have the proper logistics to keep it at that temperature that it needs to be whilst we are moving it from Abuja to the 6 geopolitical zones across the country?
My brothers and viewers at home, people are exaggerating unnecessary fears. Okay? As I said earlier on, you know, when we say mathematics, arithmetic is a part of mathematics. There's a way that they move other thermonuclear products across the country. It's just the same thing. There's no difference between it. Okay? Even all those things are when we have vaccines, even in the villages, you will see some health workers. They will carry vaccines inside the, what you call, small place, what you call, small container.
Yes,
okay?
One used for polio.
Okay. For polio. Yes. And they carry it, they distribute, and well, it's the same thing.
Pharmacist Agbojo, you have to hold your thoughts. Also joining us this morning to discuss this is Dr. Sonny Phillips via Skype, and is the technical lead, the health system strengthening and sustainability of USAID integrated health program. Dr. Sonny Phillips, good morning.
Yeah, good morning, everyone.
Yes, morning. So you welcome to the program. We're looking at COVID-19 vaccines, the preservation mechanisms, basically. And yes, pharmacist Agbojo has given us the right introduction, background, into that. But my question to you is actually this, coming from WHO, saying COVID-19 vaccines, Africa in danger, may be left behind. I think in Africa, just a few countries have been able to access the COVID-19 vaccines, Seychelles, Guinea. In fact, maybe for Seychelles, the high-income nation, they've started the campaign. But we still have many African countries yet to access this, including Nigeria. We're hoping that in February, we say we heard that Nigeria will take delivery of the COVID-19 vaccines. How ready are we? Okay.
When you say already are weak, is it to take delivery? If it's to take delivery, I would say they are actually very ready. We have the infrastructure in the country. We have a specialized warehouse for medical resources in Nigeria, not far from where I am actually now. That's the national medical warehouse, which I feel and then we have
But how effective is the COVID-19 vaccine? The Versa Biotech, vaccine. Of course, we have the one from University of Oxford, but it seems we take delivery. Firstly, we take the delivery of the Versa COVID-19 vaccine. How effective would that be?
So most of these vaccines are very effective, and that's one of the reasons for people having them, carrying them for administration. If they were effective, they will not go clear, they will not go through the first phase of clinical trials. So we need not inside here regarding their effectiveness. They are very effective. There is no being administered now that is found to be less than 90% capable of starting off the appropriate immune response. Now, to protect the person vaccinated COVID. None is below 90%.
Okay, let me come back to pharmacist Agbojo here in the studio. Yes, you're saying that we are ready to to take delivery. Are we ready to actually vaccinate people right now?
Well, what's stopping us from vaccinating? We know already those who are due for the drugs. We know them. This have shown. Okay. The first thing is that those in the hospitals. So they are the first thing to take. From there, we can give some people can be given prophylaxis. Okay. Especially the elder ones, the younger ones, they are there. So we know the people that are ready for the drugs. You know that we have started searching.
Okay. Okay. From your own perspective, you have said, okay, people in the hospital, but do you think we should prioritize people above the age of 65, or we should prioritize the younger individuals?
Well, so you see, in the health sector, there are two key set of groups of people that we always take them extraordinarily. The younger ones, because their organs have not developed. The older ones, their organs have developed, but it's aging. That is why it's still common, it's still tradition. When you go to the hospital, they say that if you have babies, don't carry them inside, because they can easily infect
because of their immune system.
Yes. Likewise, the aged people, they can easily be infected because their defensive mechanisms is wearing out. Okay, they are the first set of people. Me and you, there are so many diseases that have attacked you and that have attacked me. That because of our activeness of our defense system, it has wear off. Okay, that's why they are the people that will vaccinate last.
Okay, okay. Dr. Phillips, I want to come to you also right now. Looking at this particular question, we know that Nigeria is planning on getting about 100,000 doses, and we know that 100,000 doses is only enough for about 50,000 people because each person must get 2 shots of these vaccines. From your own perspective, what do you think? Do you think that the older people should be prioritized, or the younger ones should be prioritized, or it should be shared between both individuals?
So there's a national COVID advisory committee that is starting taking the appropriate decision regarding how this vaccine should be rolled out. We're going to talk about the basic health sign and what should guide the prioritization of vaccination. You will want to prioritize those that are exposed based on their job, as part of their job. So we want to really quickly invite those that are providing healthcare service delivery, particularly at those treatment centers. We're talking of all the care providers, including the paramedics, the cleaners, the caterers, all those that are in that space. You want to prioritize them for vaccination. The very reason is that their numbers are limited, so we don't want any one of them to come down with the disease or the ultimate really die from this disease. there are critical resources. You want to first and foremost prioritize them. In our own community, we rarely live in intergenerational setting. So you find the setting is that in most urban centers, the very old ones are in the villages. Unlike in some communities around the world, where you have both the elderly and the young ones living together in the urban center. So if the younger ones, they can do better with the disease, pick it, and they infect the elderly one in their house, those ones fall victim, and some of them may respond with very precarious complications. But that is usually not the way we live. Usually our elderly are in the villages away from us. So for now, based on the limited amount we have, the ideal thing would be to prioritize those that are the front line so that we can preserve them, continue to provide care for those that are falling ill.
Okay. I'm going to put on this question to you also, but before I come to you, Dr. Phillips, I'm going to ask this question from pharmacist Agbojo first of all. NAFDAC has said that we have been certified to a level where we can now begin to produce our own vaccines. Since we do know that the international world, the international community, looking at Europe, America, and the more developed society are able to have access to more vaccines than Nigeria or even Africa right now. What do you think? Do you think we should begin to develop our own vaccines? And if we should, do we have the right resources to do that, even though NAFDAC is saying that, well, we can actually begin to do that?
Well, I would say Rome was not built in a day. So if we cannot produce expensive ones, I think by now we should start something. We should start something. And whatever we want to start, I think for that the government should do something about petrochemicals. So what materials, one thing that I'm sure you is that we have the human resources. That one is sure. Okay? When we talk of materials, we start something. This is a new OGTV. The one that's over there was not like this one. It was started from something else. They will not come here. So in 20 years time, 10 years time, it may be moved from here into another bigger studio with more expensive and sophisticated equipment. That's where I'm going. Let us start, even if only little ones. Let's start something. So from there, we acquire experience. Then we move into the more complicated issues. Then from there, we reach our peak.
Okay.
Okay, Dr. Phillips, we do know that Nigeria has acquired 3 ultra-cold freezers to keep the VISA vaccines at the required temperature. However, in the long run, the government is still planning to invest in vaccines that are easier to store. What do you foresee?
COVID will not be the end of pandemics. We're still going to have other pandemics. It's certain. It's the nature of our world. It's the nature of the fact that we are expanding as communities to geographical locations we shouldn't. As there will be cross infections with new pandemic, new viral and other microbes there. So it's good that the country is consolidating on its cold chain capacity. However, ultimately, the ability for the country to be capable, capable of producing vaccine itself will be a good mystery. The ones that require so much cold, depth of cold chain, I'm talking of deep freezing, like -8. Ideally, you would say if all these were normal and ideal, it should not come to us. The ones we are facing, because there is the concept of the last mile delivery. How do you maintain the cold chain from producer outside the country into the country, and then the last line, the last point where that vaccine will be delivered. However, that is what we have today, and that we can use. But ultimately, it will be to procure vaccines that we can store at temperature not far off from what we are used to, particularly in relation to the national program on immunization, which is not too far from the room temperature, or at best -2, -8, and those will soon be available. So those are the ones we actually should be focused on procuring. If we can manage those better with the existing infrastructure.
Okay, when you talk about procurement, I said I wanted to ask that question also. When you say, should we begin to produce our own, should we begin to, put in resources, the finance needed, the technical expertise needed to begin to produce our own, or we should, for now, still continue to rely on the international community for vaccines?
So vaccine is not like a sachet water that you can dig a bowl today and begin to pack it the next day. These are highly technical response and technology. So it's good the country focuses on producing its own vaccine. We will not be alone. There are other developing countries that are producing their vaccine. Brazil is one, India is another, China is another, who have taken it along to, as a part of their survival, produce their own vaccine and not be at the whims and caprices of internationally produced vaccines. So that would be the route to go, but it takes a whole lot of investment. But if we want to respond to the crisis of the moment, COVID, saying we will produce the vaccine to use will not be the ideal decision to take, because that will take a long time before we get something. Because it's not just producing the vaccine, it's producing a vaccine that is safe and effective to produce the appropriate immune response.
Okay, Dr. Phillips, we do understand that right now, yes, we are focusing a lot on COVID, but then we shouldn't forget the fact that Nigeria is also battling the issue of yellow fever. And, we are trying to put a lot of focus on getting vaccines for COVID-19 right now. So do you think it's not allowing government to be able to focus on the fact that we also have the yellow fever to battle with right now?
Thank you for that question. It's not only yellow fever we are battling with. We are battling with many viral infections in the country. Actually, there is even a department for diseases that are not common, that people are not talking about. So we have to also give kudos to the government. There is no time that the searchlight has ever been off yellow fever. Yellow fever vaccination is available. There is nothing, we are not running short of it. If you need to make an international trip and you require a yellow fever vaccine, you know where to go. So I don't think the focus on COVID vaccination is negatively affecting yellow fever or any other routine immunization. No, not at the moment.
Well, Dr. Phillips, we know that 58 practitioners have made a submission on local remedy, COVID-19 solution, local solution basically, and the federal government set up a committee to screen claims of herbal cure. Do you think we can put this off?
Why not? Nigerians are doing great things all across the world. Why not? The only thing is, anything so pushed out as a remedy must be subjected to scientific processes of verifying efficacy and safety. So there is nothing that says we can't have some compounds in our herbal preps from the country that will be able to serve as remedy against COVID. We can, but it has to be subjected to scientific validation.
But what about the endorsement from WHO the phase, won't it be like the COVID-19 organics from Madagascar? We know how it went down, WHO didn't approve, and eventually it looked like it was really a hoax. So if they are going to be control, do you think they can look at us and say, yes, you guys have a proper medical cure? The fact that in terms of pharmacology, pharmacognosy, we are not that sophisticated, or we are not that advanced like what we have in Europe and the United States and some other parts of the world.
It's a mechanism to make sure that the processes are aligned with, so that the product you get at the end of the day can stand international scrutiny. So you can't say, oh, you produce a medicament and then you don't want to bring it to the table to be validated and verified by international international platform. You have to make sure you have followed the right scientific process so that when that product gets out, your WHO, your major pharmaceutical entities across the globe can verify and say truly this medicament can serve for efficacy and safety.
Okay, I want to come back to the studio right now with pharmacist Agbojo. From your own perspective, how do you think government's concentration on other forms of vaccinations have been, even though we're trying to focus on the COVID-19 vaccination rollout across the country? How do you think other vaccines are being looked at right now, even though other ones are also quite important?
Well, the question is that this time around, it seems to somebody who is not in the medical field as if COVID-19 is the only viral disease that we have. There's the polio there. Others are also there. Okay. Now, but it's because of the noise that are around. Okay. Even the one that comes before Ebola is still around. Only that is very minute. Okay. Only that is very minute. So it is because of the noise and because the population of the attack is on COVID-19 is more than the others. That is why the COVID-19 is trying to shadow others. It's not that they are neglecting other side. So they are still on other side, but more and more attention has been focused on COVID-19 because patients that contracted COVID-19 are more and more numerous than the others.
So you're saying that our storage facility is still able
they can still withstand what we need. We know what is. We have vaccines all over Nigerians. We have it in Abeokuta. We have it in Lagos. We are over there now. Okay. So if you are bringing in, for example, if you have 3 children, you are managing 1 room. Okay. And it will get to a time that when those child when they become older, okay, you know definitely that room cannot occupy you. You started thinking of, are you building an apartment? I don't want to rent another room into it. This is the same thing. So we know the spaces that are available now, okay, and we know what they are bringing in. If you know that there is not going to be enough space, then they provide the materials. That one is sure. You cannot say because they want to provide spaces for COVID-19, then they reject or they remove all those ones that's over there. No, it's never done. Because where they are treating people on COVID-19, there are also people on other viral infections. So that's the issue.
Okay, back to you, Dr. Phillips. We do know that research is still ongoing on the efficacy of this vaccine. But what does it really do? Is it that this vaccine builds one's immunity, or once one gets a shot, even if one is reckless, one cannot contract COVID-19 again?
What it does is to make your body recognize the picture of vaccine, or the picture of the virus, so that when it sees the picture of the virus, it can fight it, it can recognize it. So, however, it's not the virus itself, So any appearance like the virus, the body produces a mechanism to fight it. So what the vaccine does is to introduce into your body something that is not the virus, but looks like the virus, so that the body recognizes it and then responds to clear it out of the system. So what the mechanism is that it's not that one will not be exposed again, if one is reckless, but your body can clear it from your system. I mean, what I meant was that your immune system can clear it from your body because the body has produced what we call memory cells that can recognize that virus when your system, so it clears it. So that even when you are infected, it doesn't get to be in a amount that will you into severe illnesses and then probably die from it, because you have the soldiers in your bloodstream that are scanning that virus or anything that looks like it and are popping it out of the system. So that's what the vaccination does.
Okay, Dr. Phillips, I want to get your thoughts about the fact that one of the questions that people seem to be worried about right now is the issue of power. Power for our refrigerators at the centers across the country. From your own expertise, right now, do you think that we do have that capacity? Do you think our freezers are good enough, even if we are to have power shortages? Do you think that it will be fine? Or do you think all of these centers have the right power supply?
So let's allay the fears of the populace. This country is not just going to be dealing with COVID for the first, or COVID and similar response for the first time. This country just last year was certified polio-free. The response for getting polio out of the country was via immunization. So we have the mechanism. The premier medical warehouse at Abuja here has almost 3 lines of power supply. And so across the country. So we shouldn't have the power cut that we experience in the community does not extend to some of this strategic infrastructure. So there are backups to make sure that stuff that are kept in those warehouses maintain their integrity for as long as they're kept there.
Okay, Dr. Phillips, but are you dismissing the fears of WHO that Africa may be in danger and may be left behind? Are you dismissing that fear?
When you say, you said Africa, and capacity of countries that make up Africa very extensive. So I'm talking of Nigeria as a country, and I'm in the picture of capacity of town to cater for 100,000 vaccines. We can handle it. We have the infrastructure to handle it. We grapple with polio and immune system that ensure that we're able to unite children across the country, and polio is now a thing of the past. So that same infrastructure is still on the ground, and we'll be able to consolidate it in the light of this new pandemic. So we truly should not decide serious fear. However, that's not to say that there is no room for improvement, because we are 220 billion. So if we are going for immunizing or vaccinating the whole population, certainly we don't get our infrastructure for them.
Okay, Dr. Phillips, one of the other major worries of people is that, yes, we know that we have been able to deal with polio and some other viruses in Nigeria, but then is the do we need to educate the medical practitioners in a different way in order to understand how to vaccinate people for COVID? Or is it the same routine form of vaccination?
It's the same routine for us. There may be some two peculiarities here and there, but it's essentially the same approach, the same methodology.
Dr. Sonny Phillips, we have to let you go now. Many thanks for joining us via Skype. Dr. Sonny Phillips is a technical lead, health system strengthening and sustainability of USAID. So many thanks, Doctor. Yes, we focus on our guest in the studio, pharmacist Olukemi Agboju. Yes, well, so much talks about the COVID-19 vaccine, but the worry is, are you also prepared for perhaps fake vaccines that may hit the market? The possibility of that?
Well, the question of fakery, there's nothing in the world that doesn't have a fake substitute. There's nothing. So when you say fakery or adulteration, it's not new to pharmaceuticals. It's not new. It's not something that is peculiar to drugs. Even textiles, building materials, or some other things, we get fake products in the market. But it now comes to the question of the agency that's responsible for the control. Okay? If it's an imported things should have been checked at the border, at the port of entry, okay, to dictate. Then where the inspectors, where the control, they do the control check over there, okay. So I'm not going to be surprised if tomorrow they say that it's a fake product. But the question now is, where does it come from? It means that those people that we put at the toll gate over there, the borders, it means they're not doing their job. Okay? But whatever fake, even at all, if you want to have a fake vaccines in this country, I'm telling you, it's not manufactured in Nigeria. It's not manufactured in Nigeria.
Okay, you believe that if there are any fake ones, it must be imported?
Yes. How does it come in? How does it come in? If we are very effective at our border, how does it come in?
Looking at this fact that we are having a second wave of the COVID-19 infections in Nigeria and across the world right now, do you think that if we continue to have, because this wave seems to be higher than the last wave, do you think once this vaccine gets into the country, there might be a rush for it?
Definitely. That is African mentality. Even we do rush for food as an African man. So things has to do with our mentality. Okay? Fear that I may not have. But what I'm saying, I think by now, okay, the National Disease Control, they must have the records of those people that need to be first vaccinated. That issues. But my brother, let me tell you that when it comes in, the politics will come in. There's nothing in Nigeria that doesn't come in. Okay? People that don't need it, so they will rush for it. They will rush for it. So if we do things the way it will be done, there are some people that don't need it. Even if they need it, they will come into the second. This one that is coming in now, there's a list of people that are ready. They are ready for it. Okay, let them have it first. When the second now comes in, now people will now come. But I hope Nigerians will follow the normal line.
Okay, you are the Assistant Director of Pharmaceutical Services of Ogun State Hospital Management Board. So is possibility of local solution or discovering local solution on the front burner? Are we also looking at that?
Discovering local solution?
Having our own, local
herbal cure?
Well, you are talking with the doctor the other time about the herbal product and everything. There are certain things that I don't believe. I'm traditional to the core. I'm a Bale of a village. I believe much in the traditional medicine. Okay. The question now is the anti-malaria that we are using in Nigeria today is tablets, but it's an extract of leaves. Okay, it's an extract of leaves. Okay, so why can't we develop our own? Whatever WHO may say, I may not be interested. Let's develop our own and test it within our people. It is now, Rome was not built in a day. Even, let me tell you, if this is a drug that is common, or for example, let me say paracetamol, everybody knows paracetamol, okay? Before paracetamol comes in, you must have passed through a lot of processes. A lot of processes. If you develop a one drug today, before it can come to the national market, not less than 15 years. You want to take the normal way.
15 years?
Not less than 15 years.
But
if,
the COVID-19, okay,
now,
where?
No, that one is fast-tracked, okay? And a lot of money was pumped into it, okay? A lot of money was pumped into it. If I develop a drug now, okay, before it can get into the system, it will take a long time because you know this COVID-19.
But that can also be fast-tracked.
So no, this COVID-19 vaccines now, you know, it's been sponsored by WHO, coupled with the World Bank, okay, and they put a lot of money into it, And now, if there are some local drugs that we have in this country, okay, that needs development, okay. So, if government can fast track it, then it will reduce the numbers of years, the latent year, before it can come to the market. Okay. If you discover a new drug here, okay, try it within this area. So within a large population, then if you get to bigger population, try it at the university clinic, then with plus and minus over there, from there, open into the market with a control, okay, with a control. After, if you record, there's no drug that doesn't have positive and negative. There's no drug that doesn't have a side effect, okay? If the side effect is minimal and it's not lethal, it's not something that can cause killing. Even if after 20 years, there was an injection at that time that we have been using before I entered into universities, okay? They have been using. But I graduated in 1988. So after some time in the 90s, so there was a report that on some discoveries that was not discovered earlier before. So people report that, okay, they investigated and they found that, this thing can cause this wahala. They withdraw it from the market. Likewise, what I'm now saying is that we have our local things. Forget about WHO. Whatever we have, let us try within our people way over here. So if we get a better result, then we can now announce. We can announce. Before this anti-malaria, me and you, we live in the village. Our father lives in the village. And malaria has been living with us now. There's a way we take care of malaria in the olden days. But when the orthodox medicine now comes in now, we forget of those things now. Instead of us to develop that one along with the orthodox. So, if possible, if we can find something, we have some more advantage from it now, then we can be able to produce mass from our own. So, the question of what we spend on importation can be reduced.
Okay, you know, when you talk about local production of our own remedy to this COVID issue, the issue with most Nigerians is the fact that they don't trust our own local herbal or remedies. How do you think governments need to begin to, educate the people to be able to trust it? On the side of the herbal people that want to produce this, what should they be doing, and what should the government be doing to complement that? Because it's an issue of trust. If you do not trust it, if we're looking at COVID, the vaccine coming in, some people are still skeptical, even though it's approved by the World Health Organization. So how do we, make our own people to trust our own product here?
The question is this: if I have a product now, all those products that people are claiming, they must, before you can claim that you have a product, you must have tested on one thing or the other. And now, let government bring them in, give them a living environment. What happened is that some of those issues, by the time it not get to the government, so they will forget the source. The originator of those products are never treated well. Okay, I know some herbs that can cure some ailments. Okay, but the problem that the fear that I have is this. Now I don't have enough resources to this. But at local settings, I do give it to some people. Okay, try it. They try it. But this issue now, by now you now submit your paper to some people. Some people now will now forget about you. They will now claim that it's their own. But then now you submit to researchers. Okay, it's the researchers that work on it and present it to the government. Okay, most of those times is that those researchers, they will forget about the person that introduced it, instead of them to be treated well, so that if they have other things in the food shop, they can bring it. So at the end of the day, you just find out that what you have submitted, some people have used it to make millions of naira. They must have forget you. So next time, you will not submit.
So you're thinking that the issue is the fact that most of the people that bring up this herbal remedy, they are not exposed or professional enough or educated enough to be able to present their own, to be able to fund and present their own paper and defend it.
Most of them doesn't have enough fund. Most of them doesn't have enough fund. Because before you can produce a drug, a lot of things must have done. So we waste some resources. A lot of resources have to be wasted at the end of the day. Because if you get to the last stage, you may find out that this thing doesn't work. Okay. If it's your own now, you spend 5 million, 10 million on a product. At the end of the day, you find out that it doesn't work. So, are you at a loss or at a profit? At a loss. Okay. That area, government will come in. So, if government, okay, you wasted so much money, okay, take your money back. That one will stimulate you. Next step, if you have another idea, you want to pursue. But the one that you are pursuing, you don't have any sponsor. At the end of the day, it doesn't need the light of the day. You sold your house, you sold your property, you waste your energy, and then it doesn't need the light of the day. If you have other things again, you focus on it. You do it at local level. That's the issue.
Well, pharmacist Abujo, I know that there's a branch of pharmacy, that's pharmacology or pharmacognosy, that deals with local herbs, finding local solutions to illnesses, diseases, and all that. So, how far, how well, with that? Yes, Olayinka asked you certain questions about local solution, and I think he asked a vital question about is one thing to discover a cure, is another thing to explain. Can our drugs even pass pharmacological tests or international tests, for instance? Can we even explain stage by stage?
Well, pharmacognosy and pharmacology, there are branches under pharmacy. So, mostly pharmacology deals with herbs. Okay, deal with herbs. Collect herbs either accidentally or otherwise. Okay. We suspect. The drug that they use for diabetes, the anti-diabetes drugs today, it's not diabetes that was targeted. Okay, it's a sulfur drug. Okay, it's an antibiotics. Okay, but they find out that while they are administering those drugs to patients, their blood glucose lowered. So they now investigate. Okay, from there they discover anti-diabetes drugs. That's the first generation. This is what the same thing. If in my village I know that these herbs, if I grind, so can cure stomach upset. At the end of the day, it may not be stomach upset, it may not be curative for stomach upset. Okay, that true that we now submit is the foundation that will bring the issue coming now. Submit to pharmacology. Pharmacology deals with animals, deal with human beings. Okay, so they will not test it on rat, rabbit, pig. From there, it now comes into monkey sometimes, before it now comes into man. At least you have seen that there's a lot of stages now. So along the line, when they are trying to measure the side effects of those drugs, from there they can discover another drug again. So I told you that initially anti-diabetes is not where they are going. So they are trying to, so antibiotics that lead them to antibiotics. So one thing may lead into the other. Even what the final product may not be what they are target at the initial stage. So these are the issues. But all those things need fund. Individuals cannot fund drug discovery.
Looking at COVID, we do know that when it comes to the yellow fever, if you need a yellow fever shot, probably, for example, if a Nigerian wants to travel to some country like Ghana, you should get vaccinated with. You have a yellow fever card before you can actually go there, and they actually pay for it. Looking at the issue with COVID, do you think government should, in order to be able to procure enough vaccines, do you think government should begin to sell this to the citizens, or they should still make it free for all citizens?
Well, you see, there's certain things that are so funny in this country. Whatever, anything on earth should be free. There's anything that should be free. So it should not be our thinking. That is why people doesn't want to patronize hospitals, current hospitals, because if you go there, you will need to purchase card. You will need to buy drugs on your own. You will need to pay for the hospital bills. Only, maybe at subsidy rate. But in some advanced country, okay, whatever, anything on it is free. So that if the government focus attention to make it free, so definitely we are going to reduce diseases. Okay. So we focus. These people cannot cannot divert their energy into something else, maybe into feeding, into housing, and everything. I believe that health should be free. Whatever it may cost, health should be free.
But that will come with some form of insurance. For the health insurance we do have in Nigeria right now. So do you mean that anybody covered under health insurance should get it for free, or do you mean that it should be free either you have an health insurance or not?
Either you have insurance, health should be free.
But even in developed climes, it looks free on paper, but it's not actually free because of the insurance. Even the countries you cited.
What I'm telling you, government has a way of getting their money back.
Exactly.
They have a way of getting their money back. Okay, nothing is free. You pay.
Yes.
You pay in another way. Okay, they tighten their security and make sure that the income, the internal general revenue, they put it up.
But there is NHIS, and it's worrisome that many Nigerians have not subscribed to that.
You know, because in this country, poverty is at high level. Poverty is at high level. A lot of people have never taken their supper, and this is the money. People who have not taken supper Easter night and don't have any hope of breakfast. So if you fall sick,
Pharmacist Abujo, let me take you back to COVID-19. It seems conspiracy theories are springing up For instance, yesterday, NGF had to distance itself on Kogi governor's claim that COVID-19 vaccine is harmful. And we should know that there will be certain theories about don't take it, is this, is that. How prepared are you, for instance, or how prepared are we, to orientate people that there's nothing harmful, nothing inimical in this vaccine?
You see, there's what we call African mentality. An average African man, no matter how educated he is, doesn't believe in hospital. You get that sure. Do you know there are some people, there are some doctors, not medical doctors, people that are educated, okay? When they have some diseases, this thing, you advise them, take them, no, working this don't no, it's not for hospital, it's for local something, no. Do nothing. That one is there. Two, I'm telling you something you have not seen. Let me tell you, I'm a pharmacist. I've never seen that vaccine. I'm just hearing it. I've never feel it. I've never touched it. I've never seen it. Something you have never seen. Why are you now saying that it's harmful? Who gave you that theory? Okay? There's a water here. Someone has not drank it before. There's a bottle of water here. They say, don't take that water out, it will kill you. What's your proof? Okay? That's African mentality. Especially Nigerians fear injection, anything injection at all. Anything injection. I don't know where they discover it. And in Nigeria today, it has never entered into this country. People who have seen that vaccine, but I think those people who travel abroad, it has never come to Nigeria. Where? Where is the record? Where is the proof that where it has been using now? The numbers of people, the population of people that have been killed. Where is the statistics? So it's unnecessary fear.
Okay. Right now, as of last year, the head of the NCDC, Dr. Ikwerozu, said that by March, Nigeria would have vaccinated about 100,000 individuals, and that the vaccines were going to come in as soon as January. And yesterday we learned from the Nigeria's Governors Forum that we shouldn't be expecting the vaccines till the ending of February right now. Some questions being raised by Nigerians that, can we even trust the government right now? You told us that we're going to get the vaccines as early as possible. Now, you said we're going to get it by early January. It was moved to late January. Now it has been moved to late February, meaning that it is not possible for us to have vaccinated about 100,000 people in March, which was said initially in 2020.
A lot of factors will come in. Have they paid for those vaccines? Because I know it's not going to be free. That's what the question is. Okay? People, that sometimes you may say you want to buy one thing. I want to buy a new car. You may tell your wife that, okay, by next year I want to buy a new car. At that time, you are talking of, you are going to buy a new car. You don't have a brass funding. Okay? You still need to source those money from somewhere else. Okay? That's because have they paid? Now, the people that they are going to manufacture, they are going to sell those items into them. Those items into them, are they being properly contacted? Do they what assurance they give them? Okay, this thing will be ready by so time. Try another thing. Another thing is that the question of shipping will come in, and some other logistics. Okay. By then they come into Nigeria, you know that if they come in today, they will start vaccinating tomorrow. They still need to test. To make sure that it's what they demand that was supplied to them.
So a lot of logistics, a lot of
there's a lot of logistics problem
that goes into this.
That goes into those things. So Nigeria has a willing that they want to purchase, fine. I pray every day that God should allow them to carry their way.
Well, we will not say that vaccine may not be absolute because it may take some time for every Nigerian to get shots of this vaccine. But one thing we can always advise people to do is to also play their part, to be responsible. They should use their face mask. They should wash their hands regularly. I just wanted to collaborate. I wanted to corroborate that.
What I'm saying, what I want to say is that even let COVID goes, and other things will. That is that you take the habit. Okay, that is why that they will say that people in the health field, they are, let me say, they are extra conscious. If you touch somebody, if you shake hands, okay, the best thing before I do another thing, I must wash my hands. If I shake two hands, before you do another thing, you must wash your hands, okay? Because many times that your hands can slip into your nose, into your ear, into your eye, into your mouth. Those areas are very sensitive. These are the point of entry of most of the infections. Okay. That is that washing the hands, Nigerians don't have the habit of washing hands. Okay, so even if you know we watch it the way it should be watched. So how to give kudos to OGTV that will demonstrate through the help of the wife of the state governor to demonstrate hand washing. Fine. So when you wash hands, you make sure it is dry before you touch another thing. If I wash my hands now, I touch, I put my hand. So definitely I've not washed because whatever it is here will appear on my hands. So when you wash your hands, you make sure it is dry before you touch other things. Okay? Covering nose, covering mouth is a good habit. Only that it brings in some discomfort. Okay? Okay? Anytime you can sneeze, anytime you can cough, definitely. So it's an involuntary action that will not tell you that is coming. So definitely. When you sneeze, when you cough, you release millions of germs, of infections into the air. So whoever is around you, that immune system, his own immune system is not that active, will catch. So that's all those pharmaceutical products, washing the hands, putting the nose pads. So even then, when you get into the health facilities, you make sure they put something on their head because germs can be in the air. Then when we want to enter into theater, we want to work in the hospital, we're putting something on.
Okay, well, many thanks, pharmacist Olukemi Agbojo, Assistant Director of Pharmaceutical Services of Ogun State Hospital Management Board. So please do wash your hands regularly. It's even illegal not to use face masks when in public. So, Olayinka, we have to go.
Yes, thank you very much. Thank you very much, Pharmacist Agbojo, for coming on the program today. So, as Moses said, do continue to use all the non-pharmaceutical ways to prevent the spread of COVID-19. Use your face masks, wash your hands, use your hand sanitizers. Also, it is important to begin to do that as we wait for the rollout of the rollout of the vaccines in Nigeria. So thank you very much. We'll be back again on Monday for Newdawn. But I and Moses will be back on Friday, but then Newdawn continues on Monday. Thank you very much for watching. I am Olayinka Shodunke. In everything you're getting, do you get understanding?
ìjókòó gbogbo ẹ̀yin ará ilé gẹ́gẹ́ bí ẹ ṣe mọ̀ pé òdù ni wá a kì í ṣàìmọ̀ fólókù a tún ti dé gẹ́gẹ́ bá a ṣe ń dé láti iléeṣẹ́ wọn náà investment limited níbi tí a ti ń ṣe anjiyoyo orí ọ̀yọ́ anjiyoyo ọṣẹ ọ̀yọ́ anjiyoyo powder anjiyoyo stainless a tún ní oyin gidi níléeṣẹ́ wa à ń kó fosofúrò ẹ láti òkè òkun a tún ní anjiyoyo herbal hair mousse orúkọ ti tèmi ni Adéjọkẹ́ Fatai lákọ̀ọ́kọ́ mo kọ́ fẹ́ bá yín sọ̀rọ̀ nípa anjiyoyo orí ọ̀yọ́ gẹ́gẹ́ bí ẹ ṣe mọ̀ bá ti máa ń